Have you ever been sitting there and suddenly notice your heart beating a little faster? And you start wondering, is this just the coffee or is my blood pressure going up? It's something we hear all the time, whether in the office or during telehealth calls. So what does high blood pressure actually feel like? And more importantly, would you even know if you had it? Well, the answer is, it depends. For some people, they don't feel anything at all. They feel completely normal and only find out when they check it. But others might notice things like feeling lightheaded, a bit dizzy, or their heart racing or pounding. Some even describe a jittery, uneasy feeling, almost like too much coffee, even when they haven't had any. It can also feel like anxiety that's hard to shake, like you just can't relax, even when nothing's really going on. And when blood pressure gets really high, that's when things can get serious. We're talking about severe headaches, nosebleeds, confusion, extreme fatigue, blurred vision, trouble breathing, and in some cases, even blood in the urine. At that point, it's not something to ignore because it can increase your risk of a heart attack or stroke. And here's the thing, this is incredibly common. About 1 in 3 adults have high blood pressure. So when we talk about high blood pressure, there are actually two main types. The first is called primary hypertension. This is the most common kind, and it basically means there's no single clear cause. It usually develops over time because of things like lifestyle, your environment, and just getting older. Then there's secondary hypertension. This is when something else in your body is causing your blood pressure to go up. It could be things like sleep apnea, kidney problems, thyroid issues, and sometimes even certain medications can trigger it. And if your blood pressure comes back high, your doctor usually won't start treatment right away. Most of the time, they'll just keep an eye on it for a while. That's because some people get nervous at the doctor's office, and that alone can make your blood pressure spike. This is called white coat syndrome. So before doing anything major, they want to make sure those readings are consistent. From there, the first step is usually lifestyle changes. Things like cutting back on salt and unhealthy fats, eating more balanced meals, staying active, even simple habits, like regular exercise and staying well hydrated, can make a big difference. But if those changes aren't enough, and your numbers stay high, that's when medication might come into play. Because over time, untreated high blood pressure can put a lot of strain on your heart and blood vessels, basically overworking your system and increasing your risk of serious problems down the line. So remember, don't rely on symptoms when it comes to high blood pressure. Check your numbers, stay consistent, and take it seriously. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.